Good day to our English-speaking community. I'd like to talk to you about something specific. I mentioned that in an earlier update to you as well, and that is about the country list. As you know or might know, every now and then we release a so-called country list where the classifications for risk for COVID are mentioned in there. So there could be low risk, medium risk, and high risk countries. And some people are worried about the fact that they think, well, how do you go about making this list? Is it all haphazard? Is it like we think this or we think that, or is there a rational basis for these lists? And the truth is, yes, of course, there's a rational basis. We don't do things just by we think or we don't think, or we like this country or we don't like that country. There are things that we do look for and actually calculate. And these are the indicators that we use. So let me make this a little bit clear. So we're trying to do this and why is it possible? Let me try to answer that question first. So people are saying, well, why are you doing this? Why are you opening up the country while you know there are bigger risks coming in? Well, first of all, as I explained earlier, you need to find a balance between measures that you take and allowing the economy to keep on continuing, because that also has an impact on health of your nation. If people lose their jobs, if people lose their ability to take care of themselves and take care of their families, this has an impact on health as well, mental health as well as physical health. So we need to keep that balance in there. So what are we doing? Even if you're a mid-risk country, as you know, the measure is that you do a PCR test beforehand. This helps. In the beginning, we thought it reduces the risk of introducing somebody with COVID by 50%. But in actuality, and there's research done to that effect as well, and also with the additional measures that we take in terms of monitoring, we actually reach about 80% of reduction of the risk. So that's an important thing to remember. So we can handle it a bit better because we're actually reducing the risk for importing the disease. Not 100%, but to a significant amount. That's number one. Number two, we try to manage by this classification of lists. What do we use as indicators? We use different sources on the internet for general information that's coming in. Countries reported to the WHO, those are the official data. There's also Worldometer, there's the Johns Hopkins website. There are different websites that we look at different types of data that we use to calculate the risks that we think are involved per country. And of course, we can't do it for all of the countries in the world, so we focus more on those countries that historically are important countries from where people come from to Curacao. So those are the countries we look at most. Now, what are the things that we're looking at? We're looking at the 7-day moving average on amounts of positive cases per 100,000 of population. This is a moving average. It doesn't make sense to look per day because that might be spurious. One day a lot, the next day lower, and it goes up and down, and you can't do too much with that. So you take an average of the past 7 days, and you keep continuing looking at that. So you look at that daily average, daily 7-day moving average is what we focus on. That's one of the indicators. The second is, what is the direction of the epicurve? Epicurve is your daily cases being reported. Is it going up? Is it going down? Is it staying stable? That's the type of information that's important to determine the risk of that country for people coming here from there. Third thing we look at is the so-called positivity rate. We talked about that earlier. This number means what is the percentage of people testing positive of the total amount of people being tested. If it's too high, that might indicate that you're not testing enough. That tells you something about your public health capacity. It tells you something about the way the epidemic is being managed in that country. That's why we use that indicator as well to help us determine at which risk level we can classify the country. And last but certainly not least, we also look at the reliability of the data coming from that country. Now that's a difficult thing to assess, but we look at the general conditions within every country that we're looking at. So are we talking about a country that has lots of, challenges in terms of their basic economic levels? So is it a country stricken by poverty or by famine? Is it a country stricken the past couple of years by war or unrest? Are all of these things going on? And these are things that can hamper your public health response. So if we think that there's problems within the country and issues in the country that make it so that it is quite probable that your public health response is in trouble and that you don't have sufficient capacity to deal with it, we also look at those data very, very carefully to see whether it is totally reliable or not. Let me give an example. It could be so that somebody reports 0 cases. Now, that could be true, but it can also mean that you report 0 cases because you're not registering, because you don't have the organization to register cases to begin with. So if you know these things about this country, and that's all types of information you're getting in from elsewhere, to try to determine if this is a country in trouble or not. So we're looking at the reliability of the data, we're looking at the 7-day moving average, we're looking at the positivity rate, and we're looking at the direction of the epi curve. So we're looking at all of these things per country. We're using different sources to get the information that we need for there. And for every single country, we make our own calculations and base the decision on classification on those calculations. So you see, there's a lot of work going into it. It's serious work because we know we have to look at these things to try to mitigate the risks of people coming in with and still keeping the economy open. So I hope to have clarified that. I hope it's clear. And of course, with your help, hope to be able to keep on mitigating the risk of introducing people with COVID on the island and also spreading the disease further on our island. Thanks very much, and until the next opportunity. Thank you.